Hey there, this is Julie Lamford, the Wellness Director at Cancer Services, and I am today going to talk a little bit about physical activity and well-being and how that can impact your life as cancer survivors as you transition away from active treatment or as you're looking at sort of a maintenance place in your cancer therapy. Um, you all are hopefully participating in our Cancer Transitions Wellness Program. And some of you have probably already done some of the sessions before, and this might be a review, but to some of you, this might be new information or just something that you need as a reminder to keep moving. So I think we probably will spend about 20 or 30 minutes on this topic today. So we'll just jump right in. So, yes, our topic is physical activity and well being. And when it comes to this program with Cancer Transitions, physical activity is really a key piece in helping people to improve their quality of life, to optimize their health and their well being after a diagnosis and after active treatment. So, essentially, when we look at research on physical activity in cancer survivors, we have one major conclusion, and that is that the more physical activity that's done, the better people's well being is reported. Um, this is probably not just among cancer survivors, but among the general public. We see these results across age, across activity status, across different health levels. It improves functional status and definitely impacts quality of life. So we want people to be as physically active as they can given their limitations, and we're going to talk some about that today. So especially when it comes to cancer treatment, we know that fatigue affects the majority who are treated with chemotherapy or radiation. Some reports showing between 75 and 100% of cancer survivors who are treated with chemo or radiation do experience cancer-related fatigue. And it's really important to manage that fatigue with exercise instead of bed rest or instead of decreasing physical activity, which I know sounds a little counterintuitive to think that, well, I have fatigue and now you want me to actually get up and move. I'm too tired. But what we see is that when we encourage people to rest more, to take it easy, it doesn't actually help make their fatigue any better. It actually can contribute to that getting worse. So, as much as possible, we want to encourage people to be as active as they can. And there's actually, physical activity is the only thing that's been shown to benefit cancer related fatigue. It's not a magic cure, it's not going to make it go away. But when we study groups of people, we know that it can help. And there's at this point really nothing else that can impact that cancer related fatigue. Other things that we see with exercise, we know that it can improve your cardiovascular fitness, definitely your muscle strength, which I find with a lot of cancer patients, they don't realize it, but they've actually lost a lot of muscle after a surgery or during treatment. Part of that is just from being less active and not quite realizing it. Some of it is that everybody wants to take care of you, and so you're doing less for yourself. And part of it is just the effects of surgery, chemo, and radiation on your body composition. We also know exercise helps with weight management, which is important for healthy survivorship. We talked about fatigue. And then when it comes to your emotional well being, the anxiety and depression, self esteem issues you might have, and just your level of happiness can be improved with exercise. So it's sort of, it's something that really can improve your mood, but also improve your overall health. And so when we measure quality of life, we're looking at all kinds of different areas of your life: physical, functional, sexual, emotional. And we know that exercise can impact overall quality of life. So we definitely want you to be active if you hadn't already got that message from our Cancer Transitions program. But for a lot of people, it's hard to know, well, how do I start? Or how do I, increase from where I'm doing? And what are the actual recommendations? So our current recommendations for cancer survivors are 150 minutes a week of aerobic exercise, at least 2 days a week of strength training. And if you're not currently active, we don't want you to jump right into those recommendations. Those are sort of the goals that we want to get to someday. We want you to start where you are and work your way up slowly. And before we're done with this talk today, I'll have 5 kind of steps to help you figure out where are you, where should you start, and where do you want to go. In regards to physical activity rates, cancer survivors, when we survey people and study cancer survivors, we find that they engage in less physical activity than people who've never been diagnosed with cancer. So when we're comparing cancer survivors to those in the community who haven't faced a cancer diagnosis, we find that cancer survivors have less physical activity. 32% engage in any kind of leisure time physical activity, so that's only really 1 in 3. And in 2013, the US activity patterns of cancer survivors, they put accelerometers, which just measures your movement, and they found only 13% were sufficiently active. So, there's a lot of room, I think, for people to actually make improvements. And that doesn't necessarily mean you're going to be a marathon runner or that you're going to run at all. But what we want is for you to be using your body in a way where it helps to keep its functional status. It helps to um, build up your muscle mass, which will help fight that fatigue and help you feel better. And we have lots of great supporting evidence right here at home in Winston-Salem and at Wake Forest University. They've done several studies, lots of studies on cancer survivors and being physically active and how that is beneficial. So we know that it is, but that's not the hard part, is knowing. The hard part is actually doing it. And there's a lot of reasons that people give as barriers to participating in physical activity, with pretty much the number one reason when you're looking at this chart, this is what people say, why don't they participate in exercise at the level that they should. The number one reason is time constraints. So it can feel like, well, I don't have time to exercise. And so part of what we do at Cancer Services is to encourage people to find even just 10 minutes at a time for you to be physically active. It doesn't have to be all at once when you talk about getting that exercise in. But time constraints are a significant factor. So whatever we can do to help reduce that, to figure out how to work around those constraints in your schedule, will help you to meet your goals. The second thing is fatigue. So figuring out how to balance your activity with the fact that you're feeling that fatigue. Pain can be a significant issue if you have neuropathy or other things that have been related to your treatments or your cancer itself. That can definitely prevent you from being physically active. And so we need to figure out how we can tailor your physical activity so that it doesn't cause more pain. Upper extremity function. I know several people have mentioned shoulder pain or being really stiff after a surgery, especially if it's breast cancer surgery. Motivation. So that's just, do I really want to do this? I'm kind of comfy right here, laying on the couch. A place to be active. Do you feel like there's somewhere you can go? It's not something you like to do. That's lack of interest. And then lack of support. Well, if you don't have anybody sort of encouraging you or wanting to do it with you, that can be difficult too. So the thing is too, when it comes to physical activity and quality of life, do people choose physical activity more often if they have better quality of life? Or is it that when they're more physically active, they have better quality of life? And it might be both. And so sometimes we just have to work one-on-one with you to figure out where is it that you are? Where's your motivation? What are your options for being physically active? And how can we get you to take those action steps towards increasing it? So when it comes to our program of Cancer Transitions, we really focus on customized exercise. And that's because where you are and where another participant might be could be very different, or you might be at the same places. But where you are today is going to be different from where you are 6 months from now and where you are a year from now. And so we need to be flexible with your exercise routine and your physical activity recommendations. So we want you to figure out what works for now. When can you increase it? When do you need to cut it back? But the way you exercise could be different, from one day to the next. So you just want to be conscious of how it's going and be in touch with your healthcare providers to find something that works for you. So we're going to talk about 5 steps for becoming more physically active and doing it in a way that we know will benefit you as a cancer survivor. So the first step is to customize. When your body's recovering, it takes much less effort to feel physical exertion, but that effort is still good for you. So for some people, this can be really challenging when they maybe were used to going out for long walks or going to the gym and doing exercise classes, and then they go through treatment, and at the end of their treatment, they're thinking, oh, yeah, I'm going to get back to that. And then they start trying to do it and find out it's much harder than they expected. And that can be kind of a downer. But I want to remind you that if you're not able to exercise at the level that you used to, that's okay, because that effort that you're doing, that what feels like small steps, is benefiting you. It's good for your body. We know that. And it's going to help get you where you want to be. So what you do need to pay attention to is to learn to listen to your body and adjust your physical activity and exercise to fit how you're feeling, which for some people who might be used to doing a higher level of physical activity, this can be really hard because they may be used to kind of pushing through things before, where maybe their body's not in a place to be pushed that hard. So really pay attention to how your body is feeling. All types of activity count as exercise. So when we're talking about those bouts of physical activity that I've talked with my groups before, I say 10 minutes at a time. Is it yard work? Is it cleaning? Is it stretching? Is it dancing? Is it leisure sports or aerobic exercises? Those are all, perfectly good forms of physical activity. The example I usually give is, if you're cleaning the house, are you taking lots of breaks in between, or is that that you're cleaning kind of vigorously for 10 minutes at a time or more? And that's when we would sort of count it towards our tracking. Now, all of our body movement helps. And so even if it's not 10 minutes at a time, it's certainly better for you to be up and moving around than it is to be sitting down. So here's a movement motto. Good, safe, and comfortable. If it feels safe, do it. If it doesn't feel safe, then you need to customize it. So let's say you go to some sort of yoga class or an aerobics class, or you're out walking with a group and they're walking at a pace that doesn't feel safe to you. Maybe you feel like you're not really stable going at that pace. You need to customize it. You can slow down. You can use some kind of walking stick to help keep you feeling a little bit more stable, but do something that makes it feel safe. If you're in a yoga class or some sort of other fitness class, you should be able to ask the instructor, this doesn't feel good. What can I do as an alternate? And then if it feels comfortable, do it. But if it feels uncomfortable, then you need to customize it. So we often use bands to do our exercise with cancer transitions. And so you should be able to find some exercises with those bands that feel both safe and comfortable and are helping to work on muscle strength. So step number 2 in our process is to keep moving. So the goal is to find a way to do some form of movement rather than no movement at all. So as a dietitian, I often talk about any vegetable is better than no vegetable. And this rule applies for moving. Any movement is better than no movement at all. So even if it's getting up and walking around the couch, that is a lot better than just sitting there, or going up and down the flight of stairs in your house, or walking out to the mailbox and back, just something that gets you moving. So instead of saying, well, I can't do this or I can't do that, which it's true for all of us, there's plenty of things we can't do. But what we want to focus on is what you can do, because it's not helping anybody to make a list of all the things that you can't do. But if you can have a good list of what are you able to do, then you can start working on those things. So I shall, one step at a time, figure out how to change movement so that it feels good. Your confidence matters. And this is something that Dr. Mahalko at Wake Forest, this is her slide actually, and she has this, cat here who is just doing it. So a lot of times, if you can sort of give yourself a pep talk before you start doing your physical activity that you can do it, it really helps to give your mind over matter kind of attitude towards your physical activity, even if it's just a few minutes. So you want to keep moving. Aim to keep yourself moving throughout that exercise time, whatever it is. So if you're aiming for 5 minutes or 10 minutes at a time, if you're exercising and it's too intense during that 10 minutes and you notice that, cut back the pace, but keep moving for those 10 minutes. Constantly adjust your movements so that it feels good, it feels safe and comfortable to you, and that you're exercising within your current level of energy, which is what we're kind of going to focus on next, is how do you determine what level you should be exercising at. So step 3 is your energy level. Change your exercise to match your current energy level. So, on a scale from 0 to 10, with 0 being absolutely no energy at all, and 10 being totally energetic, which some of those people, they make really great fitness instructors, right? They have tons and tons of energy, and you're thinking, wow, sometimes those people help give you energy, but sometimes you're like, I can't, that's making me tired. So, but the purpose with this is to figure out where is your energy level, because then we want to match your exercise to your energy level. So, if we're going with 0 is no energy and 10 is totally energized, then right in the middle is 5, which is your medium energy. If your energy is a 4, don't expect yourself to exercise at a level of 6 or 8, because that's going to be really exhausting. It's not going to feel good. You're probably not going to make it through the minutes that you were hoping for. So by acknowledging your current energy level, you can actually gain energy by exercising rather than drain energy. So if you feel like your energy level is a 4, then try to choose an exercise that's going to match that energy level, and it will help to bring you up rather than push your energy down. If you find that you have more energy in the morning, choose exercises to do in the morning that might be a little bit more difficult, and then choose the ones in the evenings that maybe give you a little bit more energy. For me, I always feel like I can always go out for a walk. But when it comes to running or doing strength training, those are things that require more of my energy. And so I want to focus on those. I'm a morning person, so I need to do those more first thing in the morning. Gain versus drain. Remember that your goal is to gain energy, not drain energy. So always pay attention. And this is when your logs can come in helpful as well. Not only do you have to track your time spent being physically active or the steps that you're doing every day, but if you feel like you're not quite sure if the exercises that you're doing are helping you, it can help to actually kind of keep track of your energy level. So on that scale of 1 to 10, on your logs, can you put like, well, what energy level do you feel before you start your exercise? And what energy do you feel at the end? And start to keep track of whether that's going up or staying the same or going down. And then we can adjust what type of physical activity you're doing based on that feedback. Step number 4 is the talk test. So if you can talk without getting short of breath, you're working at a safe level. So we want you to be exercising at a pace that's going to get your heart rate kind of moving up, but not at a pace where you cannot hold a conversation. So this talk test helps you really figure out, am I pushing it too hard? And then step number 5 is actually deep breathing. So deep breathing is low and slow. You breathe low in your belly and at a slow pace. It helps to relax tension and it allows your muscles to work and energizes you. So as you're doing some of these strength training exercises, we want you to keep breathing and we want you to take deep breaths as you're doing it, with the goal being to ace your workout. So after completing your workout, you can sort of use this ACE test to decide if you had a good workout or not. So when you're thinking about tracking your energy level or tracking how your exercise went, this might be something to think about. First, for the A, were you alert mentally? Were you calm emotionally? And were you energized physically? So that helps you sort of rank, is this exercise or this physical activity, was it beneficial to me? Maintaining an exercise program. So getting started is only half of the formula, right? Keeping it up is the really hard part. And so for those of you who are participating in our Cancer Transitions program, you're maybe at the early, stages of your exercise program. We're just starting to track. We're just starting to figure out what kind of physical activity are you able to maintain and how can we increase that. So we want you to set realistic goals. You can reward yourself with, health appropriate rewards. You want to establish a support system, people who really are there to support you. So it might be other people in our Cancer Transitions program. It might be other survivors. It might be your spouse, your kids, or your work, your coworkers, your neighbors, just people who are there to support you. And when it comes to set realistic goals, that's what we usually work on in the first 2 weeks of our Cancer Transitions program, is to figure out, where are you now so that then we can start to set those goals, because it's hard to set goals when we don't know where you're currently starting. So here's some helpful tools that are actually in your workbooks, your Cancer Transitions workbooks. Exercise logs, which you should already all have. Places to record how you feel as you exercise. You want to use your buddies. Make exercise plans. So actually write them on your calendars and get into action. And I would love to hear from you guys what is actually working so that we can share those successes with our other Cancer Transitions participants. All right, so what do you do if you kind of fall off the exercise wagon? Well, first off, you don't want to guilt yourself, because guilting never helps anybody make good choices. Skip the guilt. So don't beat yourself up for falling off. You want to figure out, well, how do I get out, and get back to my exercise routine as soon as I can? Because remember, any movement's better than no movement. To me, I think some of the best things is to actually reflect on what happened. Why did you stop exercising? Or what was it about the exercise you were doing? Did you not enjoy it? Did you kind of feel like it was a lonely experience? Was it painful? Didn't fit into your schedule? Did it cost too much? So figuring out what were the things that sort of pushed you off can help us plan out, well, how are you going to pick things that are going to support you through the process? You want to take it one day at a time, so don't worry so much about the future, but thinking about, well, what can I do today? And always remember to reward yourself. So that might be maybe rewarding yourself with a massage. It could be, going to a movie, or enjoying some time with friends that you've been really looking forward to, maybe a vacation or a weekend away. But just set up something that you're sort of working towards and that your exercise can fit into. So here's our exercise prescription for aerobic activity. We want you to do 3 to 5 days a week for 20 to 60 minutes. Now, it could be all at one time, or it could be split up 10 minutes at a time. And that means prolonged rhythmic activities with large muscle groups. So that's walking, swimming, doing yoga, but things that are kind of using your large muscle groups, like your arms, your legs, your back. For resistance training, which is sort of what we might call strength training, with the bands that we gave you and the exercises we gave you, that counts as resistance training. So we would like you to do it 2 to 3 days a week. And when you're doing those, anywhere from 1 to 3 sets of 8 to 12 reps. So you should have that paper with a 15-minute band exercise program that you can do at home. If you do more sets and more reps, it might actually build up to 30 minutes. And so you can do this with weights, machines, weight-bearing functional tasks, which is sit to stand. I think many of you benefited from learning from our exercise student in terms of things that you can do at home. I'm always a fan of doing your exercises at home, if at all possible, unless you really love going to the gym. Most people do their exercise either at home, or at work, places where they don't have to take another trip. For flexibility, we're looking at 2 to 7 days a week, and really it's just doing range of motion activities, stretching, and really focusing on those joints or muscle groups that might have been affected by your treatments. So this is pretty much it for the exercise and well-being. You have chapters in your books that you'll definitely want to review. And I would encourage you also, if you have questions about this, email me. I can get you in touch with some people. It might be, as we get started with your physical activity, that we identify that you maybe need to meet with a physical therapist, or you need to meet with the exercise physiologist, or you need to have a conversation with your doctor or your nurse about the physical activity and what restrictions you might have or what suggestions they may have for you. And so that's part of this program, is just helping you get started and to troubleshoot if you're having any challenges. So I encourage you to keep up your tracking, your physical activity tracking, and let me know how it's going. Let me know what questions you have, and I'll be sending you some emails to check in and see how it's going. Thanks, and have a great day.